Dave, we have a first in a series of
I'm excited, Brian.
Ask the Doctor. Okay?
I'm excited about this because I talk about Astria and robotic surgery, and here's one of the guys that does it. So we've got Dr. Chad Williams, board-certified, fellowship-trained orthopedic surgeon, in to talk a little bit about who they are, what they do, and all of that. So I think it's this is like the rubber hits the road for me now.
Yeah.
I'm going to find out the real deal. So, Doctor, welcome, first of all.
Yeah, thank you so much for having me.
So we always say, and the Food and Drug Administration says that the doc's in the room when the robot's operating. And it's like, so tell us what it's like to be someone who does the Mako robotic procedure from the modeling of the joint to begin with, which helps you define exactly your procedure. How does this whole thing work?
Yeah, the way I like to look at it is comparing it to a carpenter. You know, a carpenter can do a really good job with hand tools, but you give them power tools, more precise tools, they're going to do a much better job. And so the robot just gives us more accuracy, more precision, and helps us do a better, quicker,
refines the
job.
Blueprint too that you're working on, right? So to keep your analogy going.
Yeah, and it's just matched up to that patient's particular blueprint rather than applying a blueprint that just fits everybody.
Was this out there when you decided to be a doctor? Did you think that someday I wanted to be the guy behind the arm and all of that, or has this come along during your development as a physician?
You know, the cool thing is it wasn't available when I first started my medical training, but as I got into surgery, these types of procedures are being refined. And then I spent a year after my orthopedic training just focusing on advanced treatment of hip and knee conditions. And that's where I had the opportunity for a year to focus on learning the robot, using it, and having a really good understanding of how it can help people.
They practice on muskrats. I don't know if you knew that. They bring muskrats in. They do a few. No,
I
just
did.
kidding.
I don't think that's
I used to do that on the farm,
true.
but that's a whole other procedure. Look, people. I guess the assumption here, and maybe it's been proven out, people suffer longer than they need to. Right? I mean, we just grin and bear it because we don't really know or understand or fully appreciate what can be done and how it can be done. What can we do on our own before we get to you to try to minimize these joint issues? And in your case, knees and hips, that sort of thing.
Yeah, that's such an important question because usually by the time that people have gotten to me, like you said, they have suffered for years and years. The first message that I'd like to give to people is, you have control of your own health. Exercise and food are both medicines that you can employ well before you get to me. As we age, our nutrition tends to go down. We gain weight easier, and our muscles atrophy or get smaller at an accelerated rate. So just by, doing a little bit of exercise every day, making sure you watch what you eat, making sure you're eating a high-protein diet to fuel your body and give it the resources to get better. A lot of these conditions for bones and joints and muscles really can resolve themselves. In fact, one of the first treatments that I'm always going to suggest to people when they come and see me is to start employing dietary practices and exercise practices that are going to support their joint health. And then I'm there if those things don't work.
Gotcha. You're the fallback rather than the first option. There are things that we can do on our own. Well, so when do we know that we've gone as far as we can with our own methodologies? I'm eating right and all of that, and I feel better, but I still have it. What's the threshold then, and what happens from there to get to you?
Yeah, that's going to be different for every person. So what I would say is when you're getting to the point where you can't enjoy your life, that you can't do your hobbies, you can't work, you can't do the things you like to do comfortably, or even at the same speed as you used to like to do, come in and talk to us, and we can direct you whether or not we need to do some more work on your end or if there's something that I need to offer you.
All right, if I work with somebody that's a real pain in my lower extremities,
I don't have a surgery for that.
He's laughing over there because he knows who we're talking about.
Hey, I got a job to do,
I got a robot that can take care of you, Lance, right there. All right, so is there a procedure that's, Michael, your preferred procedure? Do you prefer to do knees? I mean, I've had blown out knees. I haven't had hips yet, but from your own perspective and your own practice, which challenges you or thinks that you can provide the most help for someone? As a doctor, that's what I'd want to do. It's like, how can I change somebody's life? And, walk out that next day going, man, this guy's going to have a better life because of his experience with me. What procedure do you think does the most of that?
Yeah, and you hit the nail on the head. That's the thing that gets me up in the morning, is the thought that I can take somebody that couldn't do any of those things we talked about, enjoy their life, work, and enjoy their grandkids, and get them back to those things. That's what gives me really a sense of accomplishment. My focus in doing that is replacement of the hips and the knees for people that are suffering from arthritic conditions. And those sound like big, hairy, scary operations, but, we really have gotten pretty darn good at them, so we can get people up and moving pretty quick.
Man, you do. I mean, like that day.
Yeah, most of my patients, for the very most part, they're going to be walking within a couple of hours after surgery, going home that same day.
Muttering your name, I might add.
Obviously, there's going to be variations between patients, but they tend to do pretty darn well.
And do you tell your patients, don't watch those procedures on YouTube?
Absolutely.
Don't do it. Even if you're not getting the procedure.
No, as good as the internet is, we have to be careful with what it has to offer.
That's for sure.
All right, so let's say that, in our audience, we are an older audience radio station by and large. There's people there that are probably ripe for services that you provide. What is the procedure to plug in to see good old Dr. Chad Williams at the other end of the robot's arm?
Yeah, first and foremost, your primary care doctors are phenomenal, and they're going to be able to help direct you at the beginning stages of your treatment. And when they deem that you're just not making the progress that they'd like to see, then absolutely they're going to send you over to us, get a referral to Astria to see Dr. Williams to look at your joints.
And then the modeling process, is that just like X-ray pictures, imagery, and then how does the actual I don't need to give any trade secrets away here, Doc.
Yeah, nothing secret. First and foremost, I'm going to have a conversation. I got to get to know you as a person before I get to know your joint, know what your goals are and what you're hoping to get out of things. And once we've determined that, between x-rays and looking at your knee and potentially some other studies down the road, I get to know you, and then we can come up with an accurate plan of action to get your goals met for you.
You also mentioned, Dr. Williams, that diet, exercise, these are things that can play a part. Let's say somebody has a little bit of extra weight, and it's been determined that they need one of these hip or knee surgeries. Maybe they want to take some of that weight off first. Might be a good idea. I know that Astria Health offers obesity medicines through Dr. Upala, sees people in Union Gap and also Sunnyside.
Absolutely.
That's an option too.
Yeah, in fact, I spend a tremendous amount of time trying to counsel people about their health, how we can not only just do these surgeries, because that part is really not the challenge. I want to do these surgeries safely and effectively. And unfortunately, certain health conditions can compromise that. So we do everything we can on the front end to make sure that when we do get to that point of doing a surgery of any kind, that you're going to have the best opportunity to be successful immediately thereafter and for years to come.
Just for those of you who are wondering, he looks like he's in pretty good shape. I think he practices what he preaches here. Just throwing that out there.
And you don't have to go over the mountains and through the woods for this very cutting-edge technology. And there was a pun intended there, by the way.
Right here in our backyard, man.
Right here in our backyard with Astria.health. Dave, as the radio spokesperson, he preaches that to folks a lot here on the radio. So anyway, any final thought you'd like to have listeners think about?
Yeah, thank you so much for having me today, and I just want people to know I'm here for them in whatever capacity I can take care of them. So please come see me.
Can we get a robot personality exchange for someone that I know sitting to my left or anything like that?
Again, we're still working on that technology.
That's a conversation for another time. In the meantime, if you have this conversation and you got to start with your family doctor, your normal provider, and through consultation there, if this is the right path to be on, and for so many people as it is. My dad had hip replacement a few years back in his, I think, late 70s. He said it was the best thing he ever did. He was instantly moving better, less pain. I mean, it was just a life changer. Yeah. And I used the joke here before. He said his only wish is that he would have saved the bone to make some soup. But that's my dad. Seriously, he's a weirdo. But I am such a believer in this based on what I witnessed with my own 2 eyes.
Yeah.
From a guy that, kind of drug his leg around forever to somebody that was, walking around, for heart health, was able to get out and walk and move because he had the hip replacement. Yeah. So you're doing some pretty life-altering stuff, Dr. Williams, and we appreciate getting a chance to have you in here and talk about it. Now we'll put your smiling face to it when we talk about it down the road. So thank you so much.
Thank you for having me.
Dr. Chad Williams, board-certified, fellowship-trained orthopedic surgeon, and specializes in all those complex joint replacement and revision procedures with Astria Health.